Hello, my name is Carl, and I just wanted to tell a little story about the long history of sinus infections that I've had for many years. Also suffered from a deviated septum, which means I've slept on my right shoulder and only on my right shoulder for the last 50 years or so, because when I would sleep on the left, everything would slowly just plug up and I wouldn't be able to breathe through my nose, which I enjoy doing. Now, last October, it's now March, but last October I got an infection and sinus infection, started coughing, got a repeated cough that just made me sound terrible. Several rounds of antibiotics later didn't seem to make much difference, and I was referred eventually to an ear, nose, throat doctor who was also our song leader at church, which was handy. And with him I started on a 6-week mega dose of antibiotics to see if that would clear up the sinus infection. And the CAT scans were showing that the upper sinuses never did really clear up very well, and there was still infection in these side sinuses as well. So after that, I saw an allergist. They did some allergy tests to see if I was allergic severely to something. It really didn't show much. And all this time I'm using the NeilMed rinse, using this handy little bottle, which I love. Little reverse osmosis water. Use pure water if you can, and 30 seconds in the microwave kind of warms it up just a little bit, and you put in the little dissolvable powder, the salt, and whatever else is in it, and it's a very nice rinse. It feels good even if you don't have severe sinus infection. It's great in the morning anyway. But after nothing seemed to clear up that infection, we scheduled sinus surgery March 9th of 2010, and that was after about 6 months of trying other things. So I had the deviated septum repaired, trimmed the turbinates, that's the fleshy stuff inside of your sinuses, opened up some of the sinus openings a little bit more, and then rather than packing, which they used to use, about 10 feet of packing on each side, stuffed up into sinuses and the nasal cavity. Now many doctors are not using that packing anymore. It's kind of uncomfortable, but they use splints. And these splints are very thin plastic. They're about the size of the end of your thumb, and they put one splint in one side, one splint in the other, very thin, and then they put one suture through the top and the middle and the bottom of it, so it squeezes your center tissues together, and that takes the place of the packing and eliminates the need for all that packing. Also, a couple of small dissolvable tubes were inserted in the upper sinuses, and that was for drainage purposes. Now, I do get nauseas from anesthesia, and I told them that at the surgery center, and they gave me a shot to counteract that. But that helped me make mistake number one. I ate probably too much when we got home because I felt pretty good because of that medicine. Well, the nose is bleeding at this point. Your nose bleeds quite a bit, and they put a gauze pad right there with tape, and you have that on for about 5 minutes, and it's full of blood, and you take that off, throw it away, put on another one, and you go through this for quite a few hours, and this is in the place of all that gauze packing that they used to have, and eventually this is actually an easier, longer-term solution for you, is just to let it bleed, let it stop on its own, and then you can actually breathe through your nose even during your recovery. Now, my wonderful, caring wife was at my side changing this gauze every 5 or 10 minutes for 8 hours or more after we got home. And you really do need someone to care for you at home. This would be really miserable to go through alone, so try to have someone there with you. And while this was going on, I was swallowing blood. The anesthesia thing kind of wore off, and I ended up getting pretty sick, and I do not throw up easily, maybe several times in my whole 30 years of married life. But this was one of them, and I threw up about 4 times, and also had no sleep for about 2 nights, and that makes you kind of crazy. So it was pretty miserable the first day and a half, but by Wednesday later in the day the bleeding had slowed down, and eventually the nausea kind of subsided. And during the day, about every other hour, I would use this sinus rinse in the recovery process, and after about a day of using this gently into each nostril, let it rinse out. Some large chunks of clotted blood were rinsed from those sinus cavities, some of them about the size of a half a dollar. Others resembled large leeches, for the sake of you fishermen there. I also coughed up one of the little plastic tubes that rinsed clear from a sinus somewhere while I was doing this rinsing process. And they tell you to use this rinsing about 2 or 3 times a day, but I did it 6 or 8 times a day with no bad effects at all. And then a week later, week after the surgery, I had the splints and the tubes removed with only minor discomfort, and that night slept on my left side for the first time in 50 years. Now, one little known fact is that those tissues in your nose called turbinates swell up and shrink on a rotating basis, the left side and then the right side, and it's just part of God's plan. It's why your left nostril seems clearer in the morning and then your right is clearer later in the day. It's just the way your body works. Your sinuses produce from a pint to a quart of mucus each day that rinses and flows down your throat. It's clear. You never even know it's happening until you get sick, and then it gets thicker and has bacteria in it. But this surgery hopefully will open the sinuses for better drainage, reduce the occurrence of sinus infections, and that's my story, and I'm sticking with it. Thank you.